Welcome to BW Healthcare World. Thank you so much for taking out time to be with us on Thursday Thought Leaders. Dr. Shetty, I want to really ask you questions related to healthcare and specifically cardiology.
Sure.
To begin with, how do you see technology advancements like robotic surgeries when it comes to surgery, AI and blockchain when it comes to determining the understanding the disease better and diagnosing it towards personalized care, and that's what we are aiming at. What do you think? Where are we heading, and what is your opinion on technology and the role it is playing in today's world?
The tools doctors have today and the impact of that on patients' recovery following any major illness is nothing short of magical.
Right.
What used to take us maybe 10 hours of heart surgery, today cardiologists take the patient to the cath lab and in 15 minutes they finish the procedure, and next day patient walks out of the hospital.
Right.
30 years ago, what was considered inoperable, nothing can be done. Today, those patients undergo heart operation, they get better, 5 days, 10 days, they go home.
Right.
So, what healthcare has reached now is simply astonishing. That has happened predominantly because of a great interaction between the man and the machine, and also exposure to large number of patients with complex problems. We are all technicians. As we keep doing it, we get better. And lot of innovations have happened in other areas with a huge impact on our industry. And more than anything else, early diagnosis, which has happened dramatically. When I left England in 1989, at that time in the whole country, I don't think there were more than few hundred echo machines to diagnose a heart problem.
Right.
Today, every nook and corner has echocardiography facilities where young doctors make fantastic diagnosis at a very early stage.
Right.
And patients have the knowledge to undergo the procedure, because when I started my career, if you tell a patient that you need an operation, it used to take me a long time to convince them.
Right.
And today, if I tell the patient you need a heart operation, in 2 minutes everything is done, they leave the office. If I tell them you don't need the operation, I have to explain to them for at least 1 hour why they don't need the operation. Yeah, everything has changed. Yeah.
Right. So the trust on the technology has immensely increased. Right. And Dr. Shetty, what in your opinion is the future of devices and therapeutics, specifically for cardiovascular in India?
See, the implants, various devices will have a massive impact on the lifestyle, longevity, and the entire recovery process of the patients. In simple terms, hospital will undergo dramatic change. Today, if you say 100-bed hospital, about 70-80 beds are ward and room beds, 10%, 20% are ICU beds.
Right.
In the next 5 to 7 years' time, 80-90% of the beds will be ICU beds. And the ward and room beds, what we were using earlier, that activity will be done at home, where patient will be monitored remotely by the doctors. So patient doesn't need to sleep on the hospital bed.
Right.
They can sleep at home. So amazing things are going to change. Like in a heart hospital, one of the biggest problems is a sudden cardiac arrest happening in the hospital, when the patient is in the ward. In the next 1 year's time, 1 year, 1.5 years, cardiac arrest in the ward will be completely eliminated. Now, you see a typical pattern, a nurse comes in the morning, takes the BP apparatus, goes to every bed, spends 15 minutes and check the blood pressure, temperature, then she enters.
Yes.
It's all going to be history. Patients will have a small patch which will keep continuously giving the ECG with analytics. Automatically, blood pressure will be recorded, oxygen saturation, respiratory rate, restlessness, temperature, everything will be recorded real time,
Right.
24 hours. And a risk score will appear based on the patient's condition. Nurse's station will have a big TV with the patient's room number and the name, with 3 color flags, orange, green, and red. As long as green, nobody will bother going near the patient. Only when it changes the color, they will go and address it.
That's amazing, because it's going to save a lot of lives, because
Huge.
you will know the problem before it occurs.
Exactly.
Than
See, when you say cardiac arrest in the hospital, 6 hours to 10 hours before the cardiac arrest, many changes happen in the patient's condition.
Right.
Heart rate starts going up, temperature starts going down, patient gets a bit restless, oxygen level goes down.
Right.
Human eyes can't detect this.
Correct.
Whereas the sensors, they don't get tired.
Right.
And they can analyze all the minute details. And based on the analytics, the risk score will make a huge change.
Awesome. And Dr. Devi Shetty, do you think there is a need to relook at the public health policy as well? When it comes to, I believe there are 3 pillars on which healthcare works. One is the accessibility, second is the quality, and third is the affordability. Do you think something needs to happen in the public health domain so that you can impact the 3 and have healthier citizens in our country?
See, the biggest problem in our country is the affordability.
Right.
If the affordability is addressed, accessibility, availability, everything will happen.
Right.
Hospital will come up.
Yes.
Today, why hundreds of hospitals are not coming up?
Mm-hmm.
Mainly because people don't have the money to pay for the healthcare.
Right.
But that is going to change. India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy.
Right.
And India will do it in 5 years.
How will it happen, sir?
Yeah, it will, I tell you. How it will happen is, in India, everyone is going to have a health insurance.
Mm-hmm.
You're aware, a lot of major changes have happened in IRDA.
Yes.
The IRDA is now managed by people who are very passionate about universal healthcare for everyone through health insurance.
Correct.
So they are very clear that current health insurance model is not delivering. Because if you look at in healthcare today in India, there are 3 stakeholders. There is hospital, there is insurance company, and there is patient.
Yes.
These are the 3 stakeholders. Hospitals do not trust the health insurance company. Health insurance company doesn't trust the hospital. And the patient doesn't trust both parties. So in an industry, if there are 3 stakeholders and none of them trust each other, that business cannot sustain.
Absolutely.
Now that is going to change when the hospitals become health insurance provider.
Right.
The whole equation will change.
Absolutely.
Like today when I tell a patient, you need a bypass grafting, first thing comes to the patient's mind is it really required?
Right.
Because I have a conflict of interest.
Yes.
Whereas when I'm a health insurance company running the hospital is running the health insurance company, I tell the patient you need a bypass grafting. There is no conflict.
Absolutely.
Because I'm going to pay for it. Then my interest and the patient interest is aligned.
Absolutely.
So the transition will happen when the hospital become health insurance company. Like we have a desire to become a health insurance company. We will work hard to make sure that our subscribers, our members don't fall sick.
Correct.
So we will ensure that we invest heavily on primary care, early detection, because If you do that, they don't fall sick, they don't end up in the hospital.
Absolutely.
Then their interest and my interest is aligned.
Aligned.
So that is what will happen.
I'm so glad that this is taking shape because I have always believed that insurance companies should be the heaviest investors in preventive healthcare.
Yes.
Absolutely. And Dr. Shetty, I want to ask you, and I've been looking to ask you this question for a very long time, around the medical education. It is not just the gap between the demand and supply of doctors. There seems to me at least a gap between what is being taught to the doctors in the medical schools versus what they are practicing today. The changes in terms of technology, the skill set required beyond just the the medical or surgery. Do you think the medical education system needs to undergo a change? And if so, what kind of changes should be made to ensure quality is not compromised just because of quantity?
What medical education should do, we have done it in nursing education. In our hospital, we run nursing colleges.
Right.
And our nurses, they spend 6 months in the nursing college, understand the basics of it. Then, huge amount of their time, they spend in the ICU.
Okay.
Initially as the assistant to the nurses. And when our nurses finish their BSc in nursing in 4 years, they're like a nurse who's coming out with 3 years of experience in managing a critically ill patient in the ICU.
Right.
Yeah. And these girls, we have a hospital in Cayman Island. The day they graduate, they get an appointment letter. And they go to Cayman Island and their starting salary is nearly 2 lakh rupees.
Wow.
Yes. So essentially that is what needs to be done in medical education. But unfortunately what has happened, the curriculum and the way medical students are taught is like teaching people to swim in a classroom. If you want, you teach them for 10 years in a classroom how to swim. When they get into water, they'll drown.
Yes.
So medical education should change, and that should happen near the bedside. And that is happening now. It's a matter of time before these changes will happen. Yes.
Right. Dr. Shetty, you spoke about the trust, and there's a deficit of trust in the healthcare system today. How can the healthcare system work today towards building the depleting faith and trust that the patients have in their healthcare providers?
As long as there is a money transaction between the hospital and the patient,
Right.
you cannot build the trust.
Right.
It's not possible. Because every time the patient lands in trouble, the bill goes up. Then there is a suspicion that to extract money, hospitals are doing all those dramas.
Right.
So I have a dream. My dream is that when a doctor talks to the patient, the discussion is about the treatment and it's not about money. Today, it is very, very humiliating for us doctors to talk more about the money than the treatment. Today, when I tell a patient that you need a bypass, they don't talk about the risk, quality of life, lifestyle. No, they only talk about the money because that's a reality. So my dream is that everyone should have a health insurance and once a year they make the payment and rest of the time there is no financial transaction. And my dream is that hospitals should not have a cash counter.
Beautiful.
And that will happen.
Beautiful.
Yeah.
Dr. Shetty, any brand defines the culture of the institution and also the ethos of the founders and the leadership. And what is it that Narayana Health aims to stand for with its redefined branding?
See, we want to be partners of people in their wellness. we do not call ourselves as a group which manages the hospital. Hospital is just one tiny part of what we want to do.
Right.
We want to be with the patient wherever they are, whatever time they need us, whether it's 2 o'clock at night at home or whether they are traveling and having some health issue. We want to be there. And we have created vehicles today in our digital journey, tools for them to be in touch with us 24 hours. Yeah. The healthcare will undergo dramatic transformation when a digital platform is developed and it is utilized by the doctors, nurses, technicians, administrators, and the patient, and the machines which are seamlessly connected, constantly exchanging data. Then you will have the ideal healthcare. It doesn't make any differentiation between whether the patient is in front of me here or he is at home. And that is the platform we have developed. It took us 20 years to reach there. And we believe it will be a game changer.
Right.
And I can tell you that the world's largest healthcare provider will have no beds. It is going to be a software. And that is our desire, to develop that software.
And your brand, the redefined brand, will depict this.
Thank you.
And Dr. Shetty, are there any challenges as a hospital, a person who's leading the hospital? There's a lot of responsibility in running the hospital that you feel need to be addressed by the government. Is there any ask from the government?
See, we are grateful to the government for redefining the role of IRDA. Because in India, in Indian healthcare, there is only one problem. That is the money.
Right.
The moment people have enough money to pay through the insurance or whatever they have, automatically hospital will spring up everywhere. Doctors will get trained. All the doctors who have gone abroad, they all will come back.
Yes.
Right? Amazing transformation will happen. And I believe it will happen in 5 years.
Absolutely. We look forward to that. And Dr. Devi Shetty, as a parting remark, we are heading for a World Heart Day. So what would be your message to the medical fraternity and to the patients for the World Heart Day?
I have a simple message. My message is, how fit you feel has nothing to do with how fit you are. To take care of your heart, please go for a preventive checkup, irrespective of what age.
Right.
Yes.
Great. Thank you so much for your time, Dr. Devi Shetty. It was lovely speaking with you. Thank you so much.
Thank you.